By the time patients come to me, they're really in a bad position. They're scared. Some of them are terrified that they're going to end up having to be on an operating table having spinal surgery, or that the pain is never going to go away, and because of that they're going to end up being paralyzed in a wheelchair. And so when we finally get to sit down with them and explain our approach, review their MRI, sit down one-on-one and really thoroughly go through the MRI that they bring in, they feel relieved. You can see the stress just melt off their shoulders. And what's really cool about that is that because they can finally breathe and they can finally take some of that stress off, what happens is that they're able to see that there is another approach, that we can offer a non-surgical way of taking care of the same problem that the surgeons wanted to operate on, but really without having to have surgery. So if you're looking for a natural solution that can help you to avoid surgery, yet still take care of your problem without drugs, without shots, without surgery, then I invite you to keep watching this video. Most people that come into my office are tired of going from one doctor to another and going around in circles looking for answers. And you know, they deserve an answer. It's not always about surgery or drugs or shots, because those only temporarily take care of the problem. They don't really resolve it. It may knock out some of the pain, but while you're not feeling pain, you're still doing things that could be causing more wear and tear and more damage and more inflammation, resulting in additional pain. The other thing is that most people want to avoid surgery and its potential side effects because they've looked at the research. They've seen that only 15 to 30% maximum of the time does surgery even work. And most surgeons now, most orthopedists and neurologists are looking at the research and it's showing that surgery is not necessarily the best answer for a back problem or a disc problem. Now, the reason why I keep saying that surgery is not necessarily the best answer is because the disc itself is active tissue. And there's research and papers that show that because it is active tissue, it contains a significant mechanism for self-repair. Now, if the disc is able to repair itself like a muscle or a ligament or a bone, why would we not want to take advantage of that first before ever doing surgery, even minor invasive surgery, which has inherent side effects and dangers to it? If I were able to sit down with you and determine whether or not I could help you, and it didn't cost you a dime to find out, would you like that opportunity? Anytime you can avoid any kind of surgery, you should. We've developed a unique approach and combined it with state-of-the-art technology that enables you to avoid drugs, injections, or surgery. It all starts with my trademark specific 6-step protocol that I've developed over the last 30 years of working with patients, pro athletes, celebrities, and gold medalists from all over the world that enables them to get results when all else had failed them. It's become a solution that has proven to be successful in 92 to 95% of all the cases that come to us, all without drugs, shots, or surgery. Can you see how much safer of an approach this is versus undergoing any kind of surgery, anesthesia, and the potential scar tissue damage from it? Hi, I'm Dr. William Oil. And if you suffer from disc problems that are shooting down your arms or your legs or affecting your neck, back, affecting your life, I want to offer you a special gift, because there is a way to take care of them and to treat discs without surgery. So here's my gift to you. I'm going to offer you 20 to 30 minutes of my time. Together, we'll sit down one-on-one, review your x-rays or your MRIs, go over any questions you may have, which will also allow me to ask you questions to determine whether I can help you or not. Now, I know that by this time, most of you have probably gone from one office to another, and you're tired of that runaround. So I want to take all that headache out of your hair. You can ask me questions. We will go over your MRIs or your x-rays and go over everything very specifically. If there's one thing that I do here in the office that's different than any other place, is that we actually take the time to go over everything, to explain everything to you. What is a herniated disc? What is a bulging disc? What is facet arthrosis? What is desiccated disc? And so on and so forth. We'll explain to you your options. We'll explain to you how we work and the type of approach that we use that's been so successful. So if you're tired of the pain, if you want to get your life back, take me up on my offer. It's the best thing that I can do for you. It won't cost you a penny, and together we'll sit down and figure out whether I can help you or not. I look forward to your call. So just pick up your phone, dial my office, and let's get you in for a free consultation and MRI review. And let's see what we can do for you.